You're about to see some testimonial videos from Carolyn, who has been through an incredibly challenging and difficult journey with her bladder and indeed incontinence in recent years. I thank Carolyn for sharing her very emotional story with us and indeed with yourselves.
So I think that it's important that women of all ages, obviously a lot of, in my case it was the menopause, but obviously a lot of women who've just had babies go through similar situations. And I think it's incredibly important that you don't jump into the surgical route first. And I think it's probably completely unnecessary to have the surgical treatment. Having found this, I would just recommend totally that people seek, or women seek, a consultation first about the alternative methods that you can use in order to prevent this problem. And certainly, I honestly couldn't recommend Votiva more highly. It's been amazing and changed my life. So how it all started was I reached menopause, which was probably when I was about 58, or actually slightly earlier, and I started to discover that when I walked or tried to run, I would leak urine, which I'd never done before. I'd always been a very active, athletic horse rider, doing all sorts of things, and I suddenly found that my life had changed. And I sort of lost myself as a woman because it became rather degrading. It was unpredictable. I had to change the sort of clothes that I wore and frequently had to actually change my clothes because accidents would happen. So I found myself in a whole new world, a world of tenor pads and looking at tenor underwear and trying to find a solution, which made me feel old, much older than my years. And as I say, it felt degrading. So I looked into it from a medical point of view initially and was recommended surgery through the hospital route, which I had something called a mesh, which is made of polypropylene. And the consent process was very poor, so I didn't actually know all the risks. And although it fixed the stress incontinence, the plastic mesh actually cut through my organs within about 6 weeks, and that caused me immense pain, and I couldn't walk and I couldn't sit down. So it also caused me to have inflammation issues, so I blew up like a balloon. You wouldn't recognise me. There's actually an article in the Daily Telegraph about what happened to me in more detail. So I ended up having to have several attempts at removing the plastic mesh, which is described as trying to get chewing gum out of hair. So I had one lot of surgery to trim it, which I was advised that they would trim and pull the vaginal tissue back over the exposed mesh. That didn't work. So 6 months later, it came through again. So I had further surgery to try and correct that. That didn't work either. So I then had 2 centimetres removed of the mesh. That didn't work either. And eventually I had very dangerous surgery to remove a huge portion, because the way the mesh is done, it is put into the groin. So there is a vaginal section, and then there are what they call arms. They can't remove the arms, so unfortunately I still have a portion of plastic mesh in me. That improved my general health, so I could walk, and the inflammation is reduced to some extent. But what it left me with was a return of the old problem. So I was back to feeling degraded and feeling very unhappy with myself on a day-to-day basis. So I did a lot of research, and through a good friend, I found Dr. Dev Patel at Perfect Skin Solutions, and I was amazed to find that there was a non-surgical procedure called Votiva, which uses, I believe, an electrofrequency, and that helps to rebuild the tissues in the vaginal area, which then, and obviously Dr. Patel would explain it a lot better than I can explain it, and his excellent nurse who helped me. And basically that made a massive difference almost immediately. I was able to walk for long distances, which is something I'd always done in my previous life, if you like, and found that I didn't leak, which was extraordinary. So I'd gone from having large tenor pads to no tenor pads, which was amazing, and started to wear dresses again, because that was something I found that without the sport of jeans or trousers I wasn't prepared to wear dresses. The benefits that I noticed were that I could start wearing what I would consider a bigger variety of clothes. So I'd really lived in thick jeans to conceal the pads and to support that area prior to having the Votiva. And I really missed wearing summer dresses or lighter clothing because I tended to wear dark clothing which concealed any accidents. So I found that I could walk, I could do a lot more of the normal things that I'd done previously. I could jog occasionally. Gardening became much easier, and I didn't have to think all the time, am I leaking, because sometimes I wasn't aware of it happening. And so I really began to be able to focus on a much more normal life. So it's made a massive difference to me. The actual process, although it's obviously an internal, it's like a probe in a way, is it's actually not an unpleasant sensation at all. It just feels warm. Jan and I were able to chat throughout the process, and whereas I found cervical smear treatments incredibly painful, or the procedure that they use, this is not painful remotely. So it was, I mean, I expected that it might be, but it wasn't remotely. So would happily suggest that it's a good idea.
If you want to reach out to us with your own issues, then please contact my clinic today. Thank you.